Good morning. Today I'd like to show you this tooth that is malposed or in the wrong position. Essentially, this lateral incisor, it's an upper right lateral incisor, has erupted on the palate and quite far in the palate. So we're going to take this out as part of the orthodontic plan to do canine substitution. So if you take a look, this young lady's got braces in place and she's got this, we'll call it the crazy tooth, on the roof of her mouth. This is her Panorex, or a picture of her Panorex. And all the actions in here, you can get a little hint of something going on in this area, but it's very difficult because this is only two-dimensional rather than three-dimensional. So let's take a look inside of her mouth. All right, to start off with, I want to show you the syringe here. We're going to drop this carpule of local anesthetic in, slides forward, and then we go ahead and we tap it because there's a little harpoon that grabs onto this little plunger. And then we'll go ahead and we'll give some local anesthetic. Now she's already been sedated and been given some medication, so she's not going to remember any of this. So we'll retract, we'll give a little local anesthetic on the facial, and then we'll also give some local anesthetic on the palate. Back in here, and sorry, I'm going to stick my head in the mic right in here. Now, I'm also going to use some ultra long-lasting local anesthetic. This is what it looks like. You can see it's kind of cloudy. It's this encapsulated bupivacaine. This will keep the area numb 2 to 3 days. So let's give some of that. Now what I'm going to do, Siobhan, is I'm going to have to hold her head right up so I can really see well. Okay, so that we can try not to film the back of my head because that's not very exciting at all. So I'll put the local in. There's a lot of pressure. It takes a lot of pressure to get this area numb. Here. Here, a little bit here. I'm also going to put some out here too. Alright, now to get this tooth out, we're going to use some gauze, and we're going to place the gauze behind here as a little safety net. And again, we're going to keep her chin right up in the air so I can see. Make Siobhan really work here. And then I get an elevator, and with the elevator I want to start to wiggle this tooth and be very careful that I'm not wiggling on any other teeth. Just the one we want out. So wiggle, wiggle, wiggle. And that's probably the trickiest part with this, is to kind of get in there, get this thing moving without putting any undue pressure on other teeth. Okay, now I'm going to grab onto this fella and start to wiggle it and twist and convince it to be a good old fella. And just to come on out without any further ado. We are definitely winning, and there it is. So there's that silly tooth gone from that palate. It shall no longer cause any trouble. If we take a look inside of her mouth as well, see lighting wise if we can help out here. I'm going to see if I can retract. Can you see that palatal area? Yeah. So right here, we'll make sure that it's all clean, everything's healthy, looking great. That will all just heal and granulate over, so we just pack it with some gauze, and that's it. All right, so we got this young lady taken care of. She does have this unilateral cleft lip and palate, and we took this tooth number 7 that was ectopically erupted in the palate and removed it. If you take a look up here, this is just another view. You can kind of see the cleft area up here, and the malposed tooth was over in this area. That's it. I hope you enjoyed it. Remember to subscribe, hit like, and leave a comment down below. Thanks.